Okay, this is a follow-up visit with Chops. Chops is how old now?
10.
10. Chops is a retired agility dog?
Yes.
Yes. Chops came to me a couple years back. Wasn't moving very well on the jumps,
Yes.
correct?
Yep.
Very stiff in the back. Chops had been seeing another doctor that did more of a manual adjustment many times. Didn't get results very good, didn't get results that held, so she was looking for something else. She found me, and we never looked back since. Ever since the first visit, Chops has been significantly better than she ever was when she was utilizing more of a hands-on adjustment. Chops, why are you so scared? Huh? Why are you so
We're in
scared?
a different room.
Why are you so scared? All right. So, Chops normally gets reactions back through here. They used to be way stronger than this. So she's holding up all right?
Yep.
Okay. So right in here, it's actually very common for Dobermans. Most of the Dobermans I see, we get reactions in the lower back. A little bit in the knee, all the way up the thigh. Again, what we're looking for are these bounces. When I pull this trigger, nothing's supposed to happen. So when I pull the trigger and we get all this muscle contraction, what it tells me is there's neurologic interference or static in that area and in the body. So what this instrument does is it frees that. And how it frees it is, this is very specific contact point, very specific line of drive, and it's very fast. So basically we're speaking the language of the nerve. We're flipping the fuses right back on again. All right, now with Chops too, she's got some arthritis down in the lower leg here. So we're going to check her shoulder. Not too bad. We're going to come down and just stimulate these areas all the way down into the foot. We used to get more of a reaction, but we've been treating this for a good couple months now, and much less reactive down through here. This used to be actually sensitive, and we'd get a reaction up into the leg. A little bit of action in the shoulder. Chops has really always been pretty good up into the neck. So we'll just do everything and then we'll spin her. All right. Phase 2 is muscle work. So instead of being right on the vertebrae, we're on either side of the vertebrae. Where the muscle starts, where the muscle ends, we actually can get into the tendons and treat some of them too. So it's very comprehensive therapy. So look at that, okay? So again, when I pull this trigger and get these noises, nothing should happen at all whatsoever. When we put it on the area and we get all these contractions, it tells me that the nerve and the muscle aren't communicating the right way. And that's never a good thing. And even though Chops is bouncy back here, she was about 80% worse when we first started.
Oh yeah, she was bad.
This does not hurt them at all, and usually they're very comfortable. Sometimes they get a little nervous because they don't understand why they're contracting. Sometimes we will hit a sore spot. But really the instruments, even though they're very fast and very specific, they're really not strong enough to cause tissue damage or any kind of harm. And again, the animal can be in any condition, any position. As long as I'm on my points, that's all that matters. This is actually the worst leg in the front, so we'll see if we get a reaction down here. All right. So this side of Chops is a little more sensitive, okay, and we're actually getting a reaction all the way up into her upper arm, okay, a contraction in through here. Okay, we don't look for a vibration, we look for literally a muscular contraction. See, there's no motion at all from the noise, okay, but whenever we get right on that joint, we're actually getting vibration all the way up into the arm, okay. Right.
See her pulling away from it
Yes.
too.
So she's more sensitive on this side, but she's still significantly better than she was when we first started treating this area. A little bit tightness in the knee. So again, just a heck of a contraction back here. So this just tells me the stronger the contraction, the bigger the piece of the puzzle, the more of a problem it is. So right in through here, big contraction, means she's tighter than she should be. So basically what we're doing with this is we've taken a little bit of chiropractic, we're hitting meridian points with like the acupuncture points, we're doing myofascial release, we're doing some stretching, we're going to add some magnetic therapy in here at the end, which is new for Chops. So it's a combination of a bunch of different, very magnificent healing techniques. And when you mix them all together, they tend to work much better than each one individually. Stay put here. Okay, so basically, we're just going to roll these magnets down Chops' back. And what the magnetics do is whenever you put a magnet against the tissue, it increases blood flow. Whenever you move the magnet against the tissue, it sends the magnetic field all the way through. And what this does is just a little increased blood flow. Helps everything settle in a little bit better. Just one more thing to add so that Chops can be the best that she can possibly be. Chops, we're just going to hit her with this in the bad areas. We'll give her a run over everywhere, but...
And we missed last week too, remember?
Yes. We're going to run this all the way down. We can use this everywhere, just like all the other instruments. I always treat head to toe with everything, just because balance is important. I always want to have a balanced, complete treatment. So head to toe, side to side, no matter what, unless it's not safe or it's contraindicated for whatever reason. What do you think about that, huh? Is that better? Is that better? You gonna give kisses? You don't give kisses, do you?
She is running around.
Are you shy? Are you shy tonight? Are you shy? Alright, let's just spin her and you hold her rear and I'll just get this from the front.
Here.
Alright, buddy. I just need to get her back leg.
Okay, stand up. No,
Okay.
I don't get it rubbed down like that.
I just got this. She's done.
Done.
Good girl!
Good girl.
Huh.
Good girl.
Good girl.